Good morning, class. Our topic of discussion today is on special senses. My names are Dr. Salisu Ahmed Ibrahim, an Associate Professor of Human Physiology from Bayero University, Kano. What are special senses? Special senses are organs in the body that help individuals to identify things in the environment, to see, to hear, to taste, and to smell. They are all organs that help for survival of an organism. These special senses include the eye, the ear, the nose, and the tongue. Now let's take the human eye as one of the components of special senses. Human eye develops from ectodermal mesenchyme. If you remember in the embryological development, the fetus developed from an eye is so delicate but well protected by bones that surround the eye, by the eyelids that cover the front of the face, by the fluid secreted by the eye, like the tear fluid that help to fight infection. It is very important to know that an eye develops before the immune system develops, and therefore eye has no lymphatic tissues. Therefore, it's very important we protect our vision before it gets damaged. What are the functions of the eye? The main functions of the eye include 1. Vision. We use eye to see environment, to see all things around us. Number 2, eye is used for learning. It is with the eye that you'll be able to read things that are in your environment. We also use eye for equilibrium. Equilibrium means balancing. For you to be erect, you need a functioning eye to perform that. Other functions of the eye include diagnosis of diseases, various diseases that we have in the body, like diabetes, hypertension, can be diagnosed from the eye. We use eye for protection. We use eye for communication. Example, you wink with your eyes if you want to communicate certain information to individual. We also use eye for identification of different ethnic nationalities. We also use eye for cosmetic reasons. Now, the eyes, they lie within the bony socket. And this bony socket, there are 2 bony cavities that are situated in the anterior portion of the face. The shape of the cavity is a 4-sided pyramid, having apex, which leads into the brain, and the base, which is the outward in which the eye protrudes out. We have the roof, we have the floor, we have the medial and lateral walls. And the dimension of the socket differs. It has 35 millimeter in height, it has width of 40 and depth of 40 millimeters. These dimensions, they are not the size of the eye, but the size of the bony cavities that contain the eye. And so we can calculate the orbital index by dividing the height with the width times 100. Then what are the bones that surround the eye? This includes the frontal bone, maxillary, zygomatic, lacrimal, ethmoidal, sphenoidal, and palatine bones. These bones, they surround the eye, and within some of them, like the frontal, maxillary, ethmoidal, you have empty air spaces there that we call, and this is a potential area for spread of diseases. Then we have muscles that anchor the eye within the bony orbit to help to keep the eye fixed in one direction, but they are flexible in moving to a direction so that the eye can move in different directions. We have levator palpebrae superioris. This muscle helps elevate the upper lid. We have superior rectus that elevate the eye upward, We have inferior rectus, which elevate the eye, which bring the eye downward. We have the medial rectus that moves the eye in the medial direction towards the nasal side. We have the lateral rectus, which moves the eye to the lateral direction. We have superior oblique muscle. This muscle rotates the eyeball from inferior side to the superolateral direction. And we have the inferior rectus, which rotates the eye from the superior direction to the inferior medial direction. Then inside the orbit, we have orbital content, things that are contained within the bony cavities. Number one, the eyeball itself. Number two, we have nerves, which include second cranial nerve, which is the optic nerve, third cranial nerve, which is oculomotor nerve, fourth cranial nerve, which is trochlear nerve, sixth cranial nerve, which is abducens nerve, and branches of ophthalmic and maxillary nerves. Blood vessels, we have ophthalmic vessels, which include the artery, ophthalmic artery, and ophthalmic vein. We have inferior orbital vessels. We have superior and inferior branches of ophthalmic vein. We have lacrimal branch of middle meningeal artery. We also have orbital fascia and fat, and we have lacrimal gland and lacrimal sac. All these ones are contained within the orbit. This is a eye of this is a human eye. You can see the outside here is a lid. This is what we call the upper lid, and this is the eyelid. And look at the eyelashes that emerge from them. Inside this white area that you see is called the sclera, and this one, the black one here, is called the iris. At the center of it, since it is a circular muscle, we have the opening that we call the pupil. This pupil helps allow the light to pass into the eye. Now, this is the structure of the human eye. This structure, it shows that when you cut the eye in the horizontal direction, you'll be able to see the eye exists in three layers. The first layer include corneoscleral layer, which we call corneoscleral coat. It helps to protect the body. The middle layer, do you see it in blue? It contains the iris, the ciliary body, and the choroid. These three components are called the uveal tract, and this layer is mainly concerned with the nutrition of the eye because it is rich in blood supply and it delivers nutrients and oxygen to the various parts of the eye. Then the last one, which is the retinal layer, is the innermost layer. This layer starts from the ora serrata. This is the termination of the retina and come back up to the posterior part of the eye and converge as the optic disc. This is the optic disc or the blind spot. It's called blind spot because it has no photoreceptors. And this layer, the retinal layer, contains the nervous tissues. And this nervous tissue, they are the one that aggregate to form the optic nerve, which enter into the brain. Now, for the eye, the outer layer, it is a fibrous layer made of sclera and the cornea. And the sclera is an opaque and occupies the posterior 5/6 of the eye. The cornea is transparent and occupies the anterior 1/5 of the eye. Cornea and sclera, they meet at a junction that is called limbus. This is a junction that we call coleoscleral junction or the limbus. And the cornea allows the light to pass into the eye, and together with the sclera, they help to protect the eye. The sclera is tough and fibrous, therefore prevent distension of the eye and also protect the eye. Now, the middle layer is a vascular layer, which consists of the iris, the ciliary body, and the choroid. This layer, the iris extends anteriorly to form a circular aperture. This is the iris. This is another iris. This is why we have the circular aperture that we call the pupil in front of the lens. This is the lens of the eye. Its main function is to regulate the amount of light that enter the eye. I mean the iris, the main function of it. It's contract and dilates and contract. The dilation is by the radial muscle, the contraction is by the constrictor muscle. They help to regulate the amount of light that enter into the eye. The function of the ciliary body is in the production of aqueous humor, and the function of the choroid generally is to nourish the eye. Now, the other layer, which is the retinal layer, is the innermost layer called the retina. It is a photosensitive part of the eye and contains photoreceptors. These photoreceptors, they are called the rods and the cones. It extends anteriorly and terminates at the ora serrata, just as I said before. The posterior part of the retina, we have an area that is called the macular area. This area, at its center, we have another area that is called the fovea centralis. This area is the area for the highest acuity. It contains abundance of cones. It has no rods. It has no blood vessels. Now, the side at which the optic nerve leaves the eye is called the blind spot. Now, the crystalline lens inside the eye divides the eye into two compartments containing two different fluids. The anterior compartment, which contains the aqueous humor, is divided by the iris into an anterior and posterior chambers. Aqueous humor flows from the ciliary body into the posterior chamber and then into the anterior chamber and exits the eye through a channel in the angle of the anterior chamber called the canal of Schillen. At the angle of the anterior chamber, this angle is formed between the cornea anteriorly and the iris posteriorly. And there is a small sulcus there and corneal angle, which we call the angle of the anterior chamber. It contains meshwork of channels which allow the fluid to enter into the venous sinuses of the brain. The posterior compartment, which contains the vitreous humor, is a clear fluid. It helps in modifying the refractive power of the lens. By means of introduction, this is just the part of the eye that you need to appreciate. And as part of the assignment, you should be able to draw the human eye and level it completely and mention 1. Functions of the cornea, 2. Functions of the pupil, 3. Functions of the ciliary body, and number 4, functions of the retina. Thank you very much.